everyone, I am Praveena. Today we have an interesting topic about the latest technology in knee replacement with robotic system. Chennai's first fourth generation Whaley's Johnson & Johnson robotic system has launched at Prashant Super Speciality Hospital. Dr. Arumugam has performed more than 5,000 knee and hip surgeries across the world with almost 100% success rate. Joining on to the show, it's my pleasure to introduce Dr. S. Arumugam, a highly skilled proficient orthopedic surgeon who is based in Chennai. He's refining his skills for the past 25 years. Welcome, doctor. So how long you take to do a bilateral total knee replacement surgery?
Well, I am a crazy fast surgeon. Conventionally I have been doing bilateral knees, and I operate and finish off both knees in less than an hour. With the initial stages, when I was doing only the single knee using a robot, I was taking around about 45 to 50 minutes per knee. But that has reduced. Right now I'm doing it in around 35 to 40 minutes, and in no time I think it is going to get time neutral, in the sense that I'm going to do a bilateral knee in around about an hour using the robot as well. So it is initially, because of the learning curve and everything, for me to understand the robot, for the robot to understand me, we took some time to shake hands and understand each other. So now that we are in terms with each other, I am able to do the robotic surgery as fast and as precisely as possible, and much better than what I have been doing in the conventional way. So yes, it has become time neutral, and I do a bilateral knee in around about an hour's time.
Okay, that's too quick. So how successful is the total knee replacement surgery?
Oh, total knee replacement surgery is a very successful procedure.
Okay.
And this robot is just going to add to the success.
Okay.
So for the past 40 years, 4 decades, as far as orthopedics is concerned, knee replacement is the most successful procedure. And joint replacements have been so successful that patients who have not been able to walk, not even able to crawl, are walking straight and very, very comfortably. So it is a very successful procedure, and so many of my patients, I have done more than 4,500 replacements, and all my patients are very, very comfortable and very happy.
So you said physiotherapy. So how important it is?
Well, physiotherapy is very important. See, there is a lot of myth around physiotherapy. Patients who undergo replacement, the first thing they ask me is, should I undergo physiotherapy after surgery? They say that the physiotherapy is very, very painful. All this is a myth. Physiotherapy is nothing but a person. Physiotherapist is nothing but a person who is going to come to you and make sure that you do all the exercises to strengthen the muscles around your knee joint, which have become weak because of the osteoarthritis that you have been suffering with. And after surgery, the muscles will get still weaker. So to tone up the muscles, to get your patient strong, physically fit, and to be able to be as agile as possible, and to do all their day-to-day activities with ease, physiotherapy is very important. Physiotherapy doesn't mean somebody coming in, bending your knee, making you cry, and giving you more pain. No, that's not happening. Physiotherapy is nothing but you do all your exercises. Somebody to just stand by you and make sure you do your number of counts. If you're supposed to sit and lift your knee and hold it for 10 seconds or 5 seconds, the physiotherapist is just going to monitor that you're doing it properly. And when you're lifting your leg, your quadriceps has to be strong, your toes have to be towards you, your calf has to stretch. So all this have to be monitored. Otherwise you sit and you do this and you say you have done exercise. That's not exercise. You're not strengthening any of your muscles. So the physiotherapist is not going to come and give you pain. That myth is there with so many patients. So that myth has to be erased. The physiotherapist is going to just help you get strong, healthy, and walk properly as soon as possible.